All right. Well, good afternoon, everybody, and thank you for attending. Like Heather said, we'll go through some slides that we have pre-prepared, and then afterwards we'll answer any questions, and then I'll go through the questions that we received ahead of time as well. So I'm going to read these slides along with you. Today's objectives are, number one, to educate, men and everybody about the importance of men's health, heighten awareness of preventable health disease. So preventable is a key term there. Encourage early detection of disease through annual physicals, and then encourage men to seek regular medical advice, encourage men to seek treatment for disease and injury, and then to live longer, healthier, happier lives. Next slide. A lot of information here. I'm going to kind of go through it with us real quick. The question is, did you know? I think most of us assume that we do. On average, men live about 5 years less than women. Men have a higher death rate for most leading causes of death. 1 in 2 men would develop cancer. About 30,000 men would die each year from prostate cancer. And men make about half as many visits for prevention as do women. And then men are more likely to be uninsured compared to women. Next, please. And then some health facts here. Men would die at a higher rate than women from the top 10 causes of death and are victims of over 92% of workplace deaths. Life expectancy of 76.1 years, where women can live up to 81.1 years. And then they have numbers. In general, if there are 221 men that have heart disease, there will be only 130 women that have heart disease. Cancer, 195 in men compared to 134 in women. Injuries are a big factor as well. 69% in men, 30% in women. And these tend to be work-related injuries. Lower respiratory disease, it can be emphysema, COPD, usually from smoking or work exposure. 45% in men, 16 in women. Cerebral vascular disease, strokes, 39, almost 40% in men, 6 in women. And then diabetes, 30 men compared to 2.5 women. So cardiovascular disease, this is heart disease, or we mainly think about heart attacks. Then heart disease is the leading cause of death for men in the U.S. The average age of the first heart attack is 64.7, almost 65 per men. Here in our practice in San Antonio, we've seen that even younger, in the 50s as well. What attributes to that? High blood pressure, high cholesterol, smoking. This is about half of all Americans have at least one of these risk factors. And if we can change those or improve on them, the risk of heart disease goes down. Other risk factors that we need to think about is diabetes, overweight, whether we're just overweight or considered obese, unhealthy diets, fast foods, physical inactivity, not exercising, and then excessive alcohol use. And that could be anywhere from even 1 drink per day may be too much for some people. Stroke is a big factor. Sorry, the words are real tiny here, but I'll read it for you. It says stroke is the 5th leading cause of death in men. Stroke is a leading cause of serious long-term disability. So what I've seen in my practice over the years, stroke, many people recover almost 100%. Some recover 90% to where they have a little bit of weakness, but still live pretty normal lives. There's some that will end up in a nursing home, can't talk, can't walk, so forth. And then there's a few that will also pass away from a stroke. I would say majority will get some recovery, will able to go home, but may not be able to work anymore. So strokes, it's a big issue. And with strokes, it tends to be long, many years of medical issues or suffering down the road. And again, same risk factors as heart disease, smoking, overweight, diabetes, alcohol use, and not enough exercise. Go on. This next slide talks about lung cancer. and is the leading cancer killer of both men and women. This was kind of surprising to me. The 60 to 65% of all new lung cancer diagnoses are among people who have never smoked, or have quit in the past. On the good part is the good news, cases of lung cancer have been dropping since the 1980s. And that goes along with, less and less people smoking. Risk factors for lung cancer, of course, number one is smoking. Number two is exposure to secondhand smoke. Big factor. Exposure to radon gas, exposure to asbestos and other carcinogens, and then a family history of lung cancer. Okay, next slide. Prostate cancer, of course, only in men, because only men have prostates, but is the most common cancer in men. About 1 in 9 men, or mostly 1 in 10%, are going to be diagnosed with prostate cancer. It is the second leading cause of death among American men, behind only lung cancer. Finding prostate cancer when it is still at an early age offers the best hope for living cancer-free for a long time. And how do we find that? It's a simple blood test called the PSA blood test that we start at age 50. We can start sooner if there's a family history of prostate cancer. Risk factors for prostate cancer include family history. So if your dad, your brother, your uncles have it, you need to get checked. Increasing age. As we get older, there's more risk of cancer. And so as we, for sure, start at age 50, but in our 60s, 70s, still keep checking these tests. Nationality, I believe African-American men are more affected by prostate cancer than other nationalities, but we all need to get checked. And then, of course, a high-fat diet, not only does it affect heart disease, strokes, but prostate cancer as well. Next slide. Diabetes really depends on where you are in the United States. San Antonio, big factor. We see it every day, unfortunately. In the U.S., it is the 7th leading cause of death. Most with diabetes are 65. That's in the U.S. In the San Antonio, I would say it starts in the 40s and 50s. Type 2 diabetes is the most common. Type 1 are the infants or kids that have it from birth because their pancreas doesn't work. But I would say, in San Antonio, 99% are going to be type 2, which is from our diet as we get older. It develops later in life. And diabetes can affect many other health-related issues. And then this little pictures, it's how do you know if you have diabetes? If number one, labs can check it. But if not, are you tired a lot? Do you have blurry vision? Are you always hungry? Do you have ED trouble? Do you have numbness or tingling to your feet? Is there frequent urination? Those that have pretty severe diabetes, they'll have significant weight loss. And then are you always thirsty? These can happen for different reasons, but altogether, this can be a factor that, hey, maybe I have diabetes. And if I haven't had labs, I need to go to a doctor. Risk factor for diabetes, number one is being overweight, being age 45 or older. Family history of diabetes is also a factor. And for those of us that are physically active for less than 3 times a week. I know when I was in training, 20 years ago, we would say 30 minutes 3 times a week is what we would recommend. Now, most doctors, most agencies recommend 30 minutes 7 days a week. You don't have Saturday and Sunday off. It's every day. Doesn't have to be for an hour, 2 hours, but 30 minutes. But they find that if somebody does it every day, as opposed to 3 times a week, the benefits are much improved. Okay, next slide. And something that we probably don't talk enough about, suicide and depression prevention. In 2021, men died by suicide 3 to 4 times more than women. For men in the middle years, and that's 40s, 50s, 60s, stressors that can challenge traditional male roles. I'm sorry, the slide's kind of covered up there. Okay, such as unemployment and divorce, can be big factors. 6 million men have depression each year. Many are undiagnosed. Risk factors for suicide or depression include prior suicide attempts, misuse, or abuse of alcohol and other drugs. Mental disorders. If you have depression or other mood disorders, bipolar, schizophrenic, access to lethal means. That means, do you have guns in the house? Are there poisons? Stuff like that. Risk factors, if you've knowing someone who died by suicide, particularly a family member, puts you at more risk. Social isolation. Are you by yourself? Do you have any friends to talk to, and so forth? Chronic disease and disability. So they find that men that are sicker with health issues are riskier, for depression and suicide. And then lack of access to behavioral health care. And that's, I think, nationwide is an issue. So do we have enough psychiatrists? Can you see a psychiatrist? Is your doctor going to refer you to one? Is your insurance going to pay for one? And just making a general statement, I'm not sure. I believe it's true. I believe most, if not all, insurances will pay for psychiatrist referrals. All right, next. And then life expectancy by sex, whether male or female. And this graph just shows from 1933 to 2021, women still beat us. 1933, women lived to about age, I would say 63, and men right around 60. Now, or in 2021, women live to age 80, and men to about, I would say 74, 75. So it's getting better. We're getting older. And at the same time, we have to stay healthy, stay on top of things, and so forth. So again, we are living longer. I think better healthcare, better diets, and all that kind of stuff, less smoking. But still, for men, we need to catch up. The women are living longer. Next slide. Then why are men at risk? Higher percentage of men have no healthcare coverage. Why is that? I think probably, if more women, maybe married, so they get health coverage through either their own job or their husband, or more men, even if they're 40s, 50s, if they're not married or single, they may not choose insurance. They may, some people will say, no, I want to keep my full paycheck. I don't want to pay for health insurance, but which down the line will hurt them. Men make about half as many physician visits for prevention than women. In my practice, as a family practice, I do see that. Women tend to come in for their annual health care, get your annual labs done, their mammograms and so forth, when men will come when they're sick and not generally looking for routine care. Men are employed in the most dangerous occupations, mining, firefighters, construction, and so a lot of their jobs are a lot more dangerous. Society discourages healthy behaviors in men. I'm not sure what that means, to be honest with you. Healthy behaviors for us would be, I guess it is. There's a lot of macho still in the world. So what's healthy? Plant-based diets, salads, exercise, don't drink, don't smoke, don't jump off of buildings, don't do dangerous activities, stuff like that. And then in general, the last sentence there says men have less healthy lifestyles, including risk taken at a younger age. So all those things we talked about. Next slide. And then what can you do? Next slide. See your doctor regularly, even when you are not sick. An ounce of prevention is worth a pound of cure. Yeah, next slide. Stay physically active. The physical activity guidelines for the Americans issued by the U.S. Department of Health Services in 2018 for older adults, move more and sit less throughout the day. Do 150 minutes, so it's a little more than 2 hours of moderate intensity aerobic exercise each week. So that could be 30 minutes a day. Aerobic activity should be in bouts of at least 10 minutes duration. So if we're only doing, 2 or 3 minutes at a time, that's really not enough to keep the heart rate up. So at least 10 minutes for exercise. Do multi-component physical activity. So that's, you can do not just walking, but maybe do walking and then some weights, jumping jacks, sit-ups, push-ups, do a little bit of different things. Those with poor mobility should perform physical activity to enhance balance and prevent falls on 3 or more days per week. And this goes more to either someone who maybe is born with some deformity, has had a stroke, or just as we get older, 70s, 80s, 90s. For sure, my patients that are 80 and 90, high risk of falls, and we try to always encourage, some kind of balance exercise, walking, weights, just more activity, and that just walking, helps with balance. Muscle strengthening activity should be done at least 2 days a week. And that doesn't have to be with big, heavy weights. It could be simply, what they call body squats. Just standing, just squat, and then stand up. And you can do that while you're watching TV, every 15 minutes, every commercial break, stand up, and just do self squats for, 10 times and then sit down. If you're watching a football game, or I like to watch the Spurs play, stuff like that. Last sentence, when older adults should be as physically active as their abilities and conditions allow. What that means, again, if you had a major stroke and you cannot walk or jog at all, then we're not expecting you to go to the park or track and jog 5 miles. But maybe that person can do arm exercises. Maybe they can go to therapy and try to stand up, try to take steps. If you have bad arthritis, then maybe jogging is not the best thing. Maybe it's swimming. Maybe it's a stationary bike. And so I try, tell my patients not, sometimes there's reasons why we cannot exercise, but we try not to have any excuses. If someone says, "Oh, my knees hurt," so we can try, go to a gym that has a warm pool. We can do stationary bike, kind of thing. So there's things we can do, and it doesn't have to be, you don't have to run a marathon, but it's just a little bit of activity every day goes a long way. Okay, next slide. Nutritional needs. What does that mean? Vitamins. Take vitamins either in a pill or capsule or with, vegetables. And vitamin D, B12, calcium, magnesium, potassium. Have a healthy eating game plan. Sorry. And document. And document, what does that mean? For me, I'm still an old guy, do paper and pencil. I'm not a laptop guy. I'm not an iPhone guy, really. Maybe I should be. But I write things down. And I try to stick with my diet. What am I going to eat this week? Or what am I going to buy at H-E-B? I try to write it down and just buy those things. So that's what they mean by document. Eat breakfast. There are some people, men and women that skip breakfast. And anytime we skip a meal, we think maybe we're going to lose weight, but your metabolism slows down. And so we should be eating 3 meals a day, for sure. Eat at least 1 vegetable and 1 fruit at every meal. Consume the rainbow, and that just means eating different vegetables, different fruit. Try not to eat the same thing, every day as far as veggies and fruit. And then less is more when it comes to ingredients. So, hopefully we're not adding a lot of salt to our food. Even something like ketchup has a lot of salt. Cheese, stuff like that. You can have a little bit, but just not to overdo it. Try to avoid fast foods, but if we do, stop supersizing. It's even hard for me because I'm just like, oh, it's just 10 cents more, but we should try not to supersize our meals. And then whole grains, whole grains, whole grains. More fiber will keep our gut healthier, avoid constipation, and so forth. Okay, next slide. Avoid sugar-sweetened drinks and foods. And that's something from soda. Juice should be limited to 1 glass of juice per day. And then sweet tea. That's a big factor here in San Antonio. And then sugar-sweetened foods. That's simple stuff like candies, cookies, donuts, sweet bread, those things we can avoid. I guess as doctors, most of us will, quote unquote, allow our patients a cheat meal. So if say on Sunday morning, you want to go have sweet bread and so forth, you can, just not to do it every day. Avoid foods with solid fats, butter, lard, margarine, shortening, and avoid foods that are high with added fat, butter or lard, salt. So things that are, that I see sometimes I try to avoid. Maybe I eat now once every 3 months would be like a baked potato, because it's hard for me to have it by itself. I usually have to have butter with it, cheese, bacon bits, that kind of stuff. So if you like those, like I used to, maybe it would be, twice a month. Now I do it maybe once every 3 to 6 months. So you can have those things, but just less. If you do it on a regular basis, we need to try to change that. And then red meat. Red meat has been associated with more cases of colon cancer. Definitely most red meat has a lot of fat in it, which can cause high cholesterol. So in general, we try to avoid red meat. I think personally, I try to eat, baked chicken every day, fish on occasion. I used to be the guy would every Friday, let's go have a steak. I cut that out many years ago. But so if we can avoid red meat, that would be better for our gut health and in general, to help lower cholesterol. So chicken, and that does not mean fried chicken or fried fish, it's baked chicken. Actually, personally, we go to Sam's or H-E-B and we get, the bags of baked chicken. Again, I'm sorry not to endorse any, company over any other, but wherever you go get your groceries, try to get the chicken breasts without the skin. Okay, next slide. And then just a list of the sources that we got our information from. Do we have any questions yet? If not, we do have some requested questions that I can go over.
No, it doesn't look like there's any questions.
Okay. So a couple of questions that came up that we got earlier this month. Testicular exam, is it needed? We, as a family doctor, and everyone's different. Most of us will follow the U.S. Preventative Task Force recommendations. That's a group of specialists that meet, review the data of research, and kind of give us advice as to research shows these are good things to do, and these really haven't shown to do a whole lot. A good example would be the baby aspirin. All through training in the past, 15 years, we were taught baby aspirin is good for prevention of heart disease. Over the past 5 years, they found, looking at data, there's not a lot of support for that. It hasn't decreased the amount of heart attacks. It causes stomach ulcers, stomach bleeds. And so over the past several years, the recommendation now for baby aspirin is if you've had a heart attack, yes, you should take it. But for prevention, it is no longer recommended. Testicular exam kind of falls in that category. For male physicals, I usually do testicular exam, but it's something that is not recommended that we have to do for everybody. They do recommend annual blood test, the annual prostate blood test, PSA, until age 70. The colon cancer testing is recommended, but the testicular exam is good to do, but not something that's recommended by the U.S. Preventative Task Force. So it's up to you and your doctor. And I believe we may have a question. We're going to go to the chat there.
So the question is, what are the best questions to ask when having a general office visit appointment with a primary care physician?
So things you want to ask would be, for my age, whether it's doctor or PA, nurse practitioner, what is recommended that I get screened? So it depends whether if you're 40, 45, 50, 60, 70. a lot of these recommendations, once you hit 70, 75, are no longer recommended. The data shows are not helpful. They don't, and what they look at as far as helpful for us is, do they help somebody live longer? And so forth. So a lot of these things that I'll say, like a good example would be the PSA blood test. They recommend it from age 50 to 70. They find that if we do these tests in that age, if we catch prostate cancer early, we may save some lives. In general, prostate cancer is slow growing over 10, 20 years. And so they find that for us men at age 70, that lab is not very accurate and has a lot of false positives. So let's say I'm 75. I get my PSA lab done. My lab is mildly high. As a doctor, he has to send you for a biopsy. That biopsy can lead to infection, can lead to erectile dysfunction, can lead to bladder leakage. There's a lot of complications that come from it. And if let's say the worst case scenario, it finds a cancer, well, we may live 20 years with it. And so the data shows that over age 70, the PSA blood test does more harm than good. So in our practice, we stop checking at age 70. And that is also what the recommendation is from the U.S. Preventative Task Force.
Okay, so there's another question. My grandfather had skin cancer. Do you recommend me getting my skin checked by my PCP? And what age should I do that?
Yeah, that's a good question. So skin cancer, not always family linked, but it is a good idea. If you're outdoors a lot, or even if you're not, yes, at your annual physical, your doctor, should do a skin check. And if he forgets or she forgets, you can ask him, hey doc, can we do a skin check? My dad has skin cancer, or I'm worried about this mole, or that kind of stuff. So yes, it should be done at the annual physical. If you have more questions, put them on the chat. I'm also going to go through some other issues here. Enlarged prostate, or you may hear the doctor say BPH, or benign prostatic hypertrophy. So benign just means non-cancer. Hypertrophy is big tissue. For all men, we're going to get a prostate. It grows as we get older. Some men may not have any trouble, but most men are going to have urinary issues as we get older. Can start at age 50, most present at 60, 70. If you do have an enlarged prostate, do you need medicine? Do you need surgery? No, not always. What can you do to avoid the, and the main issue is going to be what we call nocturia, or urination during nighttime. Avoid fluids in the PM. What does that mean? If you go to bed at 10 o'clock, stop drinking after 6 or 7 p.m. If you take medicine for blood pressure, some of them are water pills or diuretics. Take those early morning and not in the evenings. And there are different types of meds that you can use. And you can, either your family doctor or if you have an internal medicine doctor can prescribe it. A urologist can also, but we don't always need to refer to a specialist if we could try the medications and some of the dietary changes in our regular offices. Next on my list was a question on, along with the testicular exam, also the prostate exam. During my training, it was recommended that we did a prostate exam, which is a rectal exam with our finger, once a year. The U.S. Preventative Task Force, over the past several years, have recommended that it's not required. The data show that it's not very accurate. What that means is my exam, what I feel with my finger may be different from somebody else. And it's just not a very accurate test to do. The PSA is a blood test that has, it's a very good test, between age 50 and 70, and that's what's recommended. But they no longer recommend doing a finger wave or rectal exam for prostate. A question came up about low T, or low testosterone. Big topic these days. I would say I get a lot of questions, and there are some outlying little clinics There's the hymns stuff on the internet. There are a lot of things over the counter. I would say ask your doctor for what they recommend. Most of those that we find over the counter issues or commercials, a lot of it is maybe not lies, but the truth can be presented in a way that's not always accurate. It may not be helpful for everybody or anybody. How do you know if you have low T or low testosterone? Your doctor, we can do a blood test to check. Symptoms that people have, low libido. And that means like low desire to have intercourse. Many men will have erections in the AM. If you're not having those anymore, you did when you were younger, that could be low T. It says decrease in body hair. So not only maybe am I losing hair from my scalp, but are my legs losing hair or my arms losing hair? That could be a sign of low T. Osteoporosis diagnosis, more commonly in men. If a male has it, think about low T as well. They mentioned gynecomastia, and that's men's breasts enlarge. As we get older, that happens. If you think your male breasts are larger than you expect them to be, then that's another reason to get tested. And then small testicles. So as we get older, our testes are going to get smaller. If you feel like, hey, mine are smaller than they should be, ask your doctor for a testosterone blood test. And then if it is low, what do we do? As a family doctor, and again, everyone's different on what they treat. I tend to refer to urology. There are different things they can use. There are topical, there's creams you can do, there's patches that you can use, and then there's injections. And they're asking, well, for testosterone replacement, who should not use it? So testosterone replacement has been linked. It can worsen prostate cancer. So if you have a history of it, or I tell my patients there's a family history, I just would not use testosterone. If you have severe symptoms with the prostate, if you're getting up to urinate 5-6 times a night, I would not take testosterone. It makes it worse. If you have sleep apnea, it's linked to making sleep apnea worse. There's a small risk of a DVT, which is a blood clot in the legs, and also a small risk of heart disease. So if you have a history of heart disease or a family history of heart disease, I do not recommend testosterone replacement. What is the natural range of testosterone? It ranges from about, on most labs, between 300 and 900. They've done studies, many studies. I have a graph here that says when you're age 20, the average is 700. At age 30, it goes down to 500 is the average. At age 40, it's about 350. And then age 50 is at 300. So the lower limit of normal. So naturally, as we get older, our testosterone is going to drop. So for men over 50, if we check you, it's going to be low. A lot of men want replacement, but I try to tell them that's just natural. Your body's going to go, you're going to fall under normal range, usually at age 50. At 60, the average number is 200. And at age 70, it's in the 180s. And again, normally it's 300 to 900. So something that you have to talk to your doctor about. There are risks with it. There's some benefits. Personally, I'm not a big prescriber of it, but we do have a few patients that do need it and do get it. Another question that came up, so looking at time, we got plenty of time. Sleep apnea. What is it? Sleep apnea. Many of us will find it, they either say, if we sleep with somebody, they say that we snore a lot, or you stop breathing during sleep. It's a guy that, snoring and then stops and then starts again. Or if you wake up gasping for air, stop breathing. That could be sleep apnea. Simple fix. I've got a lot of patients. Like I said, I've got family members, friends who have sleep apnea. The machine, the CPAP machine, they love it. It is hard to get used to. From what I understand, when you first start it, once you get used to it, everybody loves it. I've got a funny story I tell my patients. I got a good friend of mine who has sleep apnea. We went on a hunting trip a couple of years ago to Oklahoma. We drove, overnight, 12 hours. We get there, we're unpacking our suitcases and stuff, and he says, "Oh my God, I forgot my gun." He goes, "But I have my CPAP." So, the CPAP was more important to him than the gun. So people like it once you get used to it. The definition, it says it's intermittent breathing interruptions during sleep. So it is where our body will stop breathing for a second or two. And that's enough for us not to complete our sleep cycle. And if you get sleep interrupted, you're not going to rest. And so it causes chronic fatigue, causes you to be tired. If you're someone who's at a stoplight and you fall asleep, that could be sleep apnea. Or if you're at work and you get sleepy after lunch, it's either you had a big lunch or it could be sleep apnea. How do we treat it? Most of it is called CPAP. That's for continuous positive airway pressure. So most of it's going to be a mask. They have some that's a nose, and it gives pressure while you're sleeping. What I tell my patients is try to use it. If you can use it in the first night, you can do it for the full 8 hours. Great. My experience with my patients is most will use it for an hour or two for the first week. And I said, that's fine. Try it, get used to it. If you're not comfortable, you can take it off. Next night, try it. And we see that if you do it every night on a continuous basis, you'll be able to use it more and more and more. And people do feel better. They're more rested. They're not as tired, not as cranky. They feel more energetic. So I'm a big believer in getting people tested. I'm a big believer if you test positive for CPAP, for sleep apnea, to try a CPAP machine. Again, the CPAP, the full face mask is most common. The nose airways are also there, but I would say probably 90% of people use mask, less use the nose pillow. What else is there? There's also an oral device, sort of like a mouthpiece, and it's supposed to make your lower jaw extend a little bit when you're sleeping. So sleep apnea, in our throat, the tissue is real close together. And when we sleep with sleep apnea, it'll close down for a second. And that's when we stop getting air. The positive pressure will just keep that airway open the whole time. So without the air, you may close a little bit, your airway to your lungs. What the positive air prep with the CPAP is going to keep that air pushing the tissue open the whole time. The oral device pulls your jaw outward and your tongue as well. So mechanically, it keeps it open. Side effect I've heard, some people get sort of soreness. They'll wake up and their jaw is sore. It kind of hurts. It's like somebody just, pulled your jaw open the whole night. But if you don't like the machine or can't tolerate it, the oral device, they're made by dentists, is another good option. There's a new thing that came out. It's called Inspire. Personally, I think I'm a little bit afraid to recommend it. It's a device, electrical device that gets inserted into your throat, and it's got electrical signal that will stimulate your muscles to open up during sleep. So it's got a sensor, and if it senses your oxygen dropping, it signals your muscles around your throat to contract or to open up and let you breathe better. It's fairly new. My patients, I would say, I don't know if I would do it yet. Maybe down the road as we have more experience with it. But if you really have tried everything else and nothing else works, that is another option out there. So more and more stuff coming out every year. Okay, another thing that came up was weak ejaculation. What are some of the causes of it? Number one, just age is the most common factor. But this also happens to men that are younger. If you're a younger guy, say under 50, things that have come up that can cause weak ejaculation would be alcohol use. The alcohol will decrease central nervous system stimulation. It affects the nerves to the penis, and it will affect our ejaculation amount. Depression, if somebody's depressed, also has an effect on our ejaculation. Nerve damage, if you're diabetic, that can cause nerve damage. If you have a spinal cord injury, if you have a herniated disc, those things are also factors. If you have an enlarged prostate, if you've had prostate surgery, those surgeries are usually very, very good, but because there's a lot of nerves around there, you can get nerve damage, and that can also cause trouble with ejaculation. Medications can sometimes cause it. There are some antidepressants, beta blockers for blood pressure. If you're on a muscle relaxer, painkillers, all these, not saying they will, but they can be factors in weak ejaculation or less amount of ejaculation for men. And the last question we had was GERD or reflux. GERD is gastroesophageal reflux disease. What are some natural remedies we can do? I can tell you personally, I have GERD. I cured it naturally by changing my diet. So again, I used to be the guy that would go get steaks, on Friday. Haven't done that in many years. I find that if I eat, and I love Mexican food, but if I eat greasy Mexican food, I'm going to have reflux. So if I avoid steaks, greasy food, I tend to have either no reflux or much decreased. And that's when I did research, that's what came up. It says diet. Avoid spicy foods. Avoid greasy foods. Avoid heavy meals. So it's better to eat, a little breakfast, a little lunch, a little dinner, as opposed to saying, oh, I'm going to skip breakfast and have a big lunch and have a, very tiny dinner. We do want to eat 3 meals a day. It says avoid carbonated drinks. So that could be sodas. That'll cause more gas to come up, which can cause acid reflux. Alcohol, it also weakens our muscles. So our esophagus, where we swallow, when it hits the stomach, there's a sphincter. It's a muscle. And when we eat or drink, it opens up, lets food and drink pass, then it should close. What makes it weak? Sometimes it's genetic. Some men or women, it's going to get weaker as you get older, so you're going to have heartburn. If it is weaker, things that will make more acid come up into our chest or esophagus would be those things we talked about. Alcohol weakens that muscle. It makes it open more. So more chance of acid coming up. So soda, more bubbles, makes more acid come up. What can avoid it? What helps? They find that ginger actually helps decrease reflux. And again, it says avoid chocolates, avoid sodas. Which foods have high acid? 3 that came up, tomatoes, citrusy fruits, so grapefruit, oranges, and then mint. I tend to use breath mints because I see patients all day. That's a risk for reflux. Smoking is a risk also for reflux. Losing weight. The more pressure, the more fat we have on our belly, it does squeeze our stomach. And they find that as we get heavier, more reflux occurs. Those of us or those men and patients that lose weight, they will have less reflux. And then if you do have reflux, you can also, sleep with 2 or 3 pillows or raise the head of the bed. Besides these natural remedies, there are good prescription meds. Over the counter, and again, not to promote any single one, but Tums, Rolaids, or antacids. There's over-the-counter Pepcid. There's prescriptions. Nexium is real common. Protonix. There's several other meds that are out there. And again, just talk to your doctor. But at home, you can try, if you eat, spicy food, rich foods, greasy foods. I would just try to avoid those as much as you can. And those are all the questions that we had. I'm still here until 1 o'clock, so we have about another 10 minutes. If you have other questions you want to put on there, on the chat, I'll be happy to answer them as best I can. And like I said, we're taking new patients, whether you have a doctor already or if you want to try somebody new. Again, I am on 410 and Blanco for Health Texas. Our office number is 210-384-8282. If you want a new doctor, I'm happy to take new patients. And with Heather, I'll work with her. If she needs more talks, I'll be happy to do these in the future. Didn't take much time. For me, it's during my, hour break and I'm happy to do it. I hope this was helpful. And again, for men, go get the biggest thing that I found in my readings is that men, we just don't go into the doctor as much as women do. Women live longer. They tend to care for their bodies, their health more than men. We do riskier stuff. I think more men probably drink more alcohol, eat fattier foods, smoke more, do dangerous things, ride motorcycles or, stuff like that. So yeah, go to your doctor. If you can, start at age 40, for sure at age 50, you should be going every year.
What other questions do you guys have? All right. Well, thank you guys. I greatly appreciate your guys' time and joining. As I said earlier, we will send you out a copy of the recording. And thank you guys for joining us today.
Have a good day. Bye.